Doctors are urging people to know the warning signs of a stroke.
For my friend, Luke.
And for my mom, Phenia.
For my husband, Helmet.
For my mom, Paulette.
Honor someone you love by learning the warning signs of stroke.
If you see face drooping, arm weakness, or speech difficulty, it's time to call 911.
A stroke can happen to anyone at any age.
Are you aware of the warning signs that could indicate a stroke is imminent? Recognizing these signs as early as possible is crucial to seek medical attention and potentially save a life. This video will shed light on the 12 warning signs that may appear 1 month before a stroke occurs. Strokes are a serious medical emergency with long-lasting consequences, but knowing the warning signs can help you take immediate action. These signs should not be ignored, from sudden and severe headaches to unexplained dizziness and difficulty speaking. By understanding the symptoms and knowing what to look for, you can better protect yourself and your loved ones. So let's dive into the details and equip ourselves with the knowledge that could make all the difference in stroke prevention and early intervention. Understanding strokes and their warning signs. Strokes occur when the blood supply to the brain is interrupted or reduced, leading to a lack of oxygen and nutrients. This can happen when a blood vessel in the brain bursts, hemorrhagic stroke, or a blockage to the blood vessels leading to the brain, ischemic stroke. In both cases, the brain cells are deprived of the necessary oxygen and begin to die within minutes. Recognizing the warning signs of a stroke is crucial because early intervention can minimize damage and improve the chances of recovery. The importance of recognizing stroke symptoms early. Time is of the essence when it comes to a stroke. The longer the brain is deprived of oxygen, the more severe the damage can be. That's why it's crucial to recognize the warning signs and seek medical attention immediately. By acting quickly, healthcare professionals can administer appropriate treatment and potentially prevent future damage. Remember, every minute counts regarding strokes, so do not hesitate to call emergency services if you suspect someone is having a stroke. Sudden and severe headache. A sudden and severe headache is one of the most common warning signs of a stroke. This headache may be accompanied by dizziness and nausea, weakness or numbness on one side of the body. Another warning sign is sudden weakness or numbness on one side of the body, including the face, arm, or leg. This may be accompanied by difficulty speaking or understanding speech. Loss of balance or coordination. If you suddenly have trouble walking or experience a lack of coordination, it could be a warning sign of a stroke. Blurred or double vision. Vision problems, such as blurred or double vision, can also be a warning sign of a stroke. Trouble speaking or understanding speech. Difficulty speaking or understanding speech is a common warning sign of a stroke. This can manifest as slurred speech or difficulty finding the right words. Dizziness or vertigo. Feeling dizzy or experiencing a spinning sensation, vertigo, can be a warning sign of a stroke. Confusion or trouble understanding. Suddenly becoming confused or having trouble understanding others can indicate a stroke. Seizures. Although less common, seizures can be a warning sign of a stroke, especially if they occur suddenly and without a history of epilepsy. Loss of consciousness. In some cases, a stroke can cause a sudden loss of consciousness. Fatigue or weakness. Feeling unusually fatigued or weak can be a warning sign of a stroke. Changes in behavior or personality. A stroke can cause sudden changes in behavior or personality, such as irritability, mood swings, or depression. Difficulty swallowing. Trouble swallowing or a sudden change in the ability to eat or drink can be a warning sign of a stroke. Physical warning signs of a stroke. In addition to the common warning signs mentioned earlier, strokes can also manifest with physical symptoms. These physical warning signs include facial drooping. One side of the face may droop or feel numb. Arm weakness. One arm may become weak or difficult to move. Leg weakness. One leg may become weak or difficult to move. If you or someone you know experience any of these physical warning signs, it's important to seek medical attention immediately. Cognitive warning signs of a stroke. In addition to physical symptoms, strokes can also affect cognitive abilities. Some cognitive warning signs of a stroke include confusion, suddenly feeling disoriented or having trouble understanding others, memory problems, difficulty remembering recent events or struggling with short-term memory, difficulty with problem solving or decision making, trouble making decisions or solving problems that were once easy. If you notice any of these cognitive warning signs, it's essential to consult a healthcare professional as soon as possible. Emotional warning signs of a stroke. Strokes can also impact emotions and moods. Some emotional warning signs of a stroke include sudden mood swings, experiencing sudden mood changes, such as going from happy to sad, or calm to irritable, depression or anxiety, feeling persistently sad, hopeless, or anxious, emotional lability, having difficulty controlling emotions, leading to unexplained crying or laughing. It's important to remember that these emotional changes can be caused by various factors, but if they appear suddenly and are accompanied by other stroke symptoms, it's essential to seek medical attention. Lifestyle factors that increase the risk of a stroke. While strokes can occur without warning, certain lifestyle factors can increase the risk. These factors include high blood pressure. Uncontrolled high blood pressure is a significant stroke risk factor. Smoking. Smoking damages blood vessels and increases the risk of strokes. Obesity. Being overweight or obese increases the risk of strokes. Physical inactivity. Leading a sedentary lifestyle without regular exercise can increase the risk of strokes. Unhealthy diet. A diet high in saturated fats, cholesterol, and sodium can also contribute to the development of strokes. By addressing these lifestyle factors, you can significantly reduce your risk of experiencing a stroke. Steps to take if you or someone you know experiences stroke symptoms. If you or someone you know experiences any of the warning signs mentioned earlier, taking immediate action is crucial. Follow these steps. Call emergency services. Dial the emergency services number in your country, such as 911 in the United States, and explain the situation. Stay with the person. If someone you know is experiencing stroke symptoms, stay with them and provide reassurance until help arrives. Do not drive to the hospital. It's important not to drive the person to the hospital yourself. Emergency medical services can provide the necessary care and transport. Remember, time is critical for strokes, so do not hesitate to seek medical attention. While some risk factors for strokes, such as age or family history, cannot be changed, there are steps you can take to reduce your risk. Control blood pressure. Regularly monitor your blood pressure and take steps to keep it within a healthy range. Quit smoking. If you smoke, quitting is one of the best things you can do for your overall health, including reducing the risk of strokes. Maintain a healthy weight. If you're overweight or obese, losing weight through a combination of healthy eating and regular exercise can help reduce the risk of strokes. Exercise regularly. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity weekly exercise. Eat a healthy diet. Focus on a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, while limiting saturated fats, cholesterol, and sodium. Manage diabetes. If you have diabetes, work with your healthcare team to control your blood sugar levels. Limit alcohol consumption. Excessive alcohol consumption can increase the risk of strokes, so it's important to drink in moderation or avoid alcohol altogether. Manage stress. Chronic stress can contribute to the development of strokes, so find healthy ways to manage stress, such as exercise, meditation, or engaging in hobbies. By incorporating these lifestyle changes into your daily routine, you can significantly reduce your risk of experiencing a stroke. Treatment options for strokes. When it comes to treating strokes, time is of the essence. The main goal of treatment is to restore blood flow to the brain as quickly as possible. Treatment options for strokes include medications. Depending on the type of stroke, medications such as clot-busting drugs, thrombolytics, or antiplatelet drugs may be administered to help dissolve the clot or prevent further clot formation. Medical procedures. In some cases, medical procedures may be necessary to remove the clot or repair the damaged blood vessels. These procedures include mechanical thrombectomy or carotid endarterectomy. Rehabilitation. After a stroke, rehabilitation is crucial for regaining lost function and improving quality of life. Rehabilitation may include physical therapy, occupational therapy, speech therapy, and psychological support. The specific treatment approach will depend on the individual and the severity of the stroke. It's important to consult with healthcare professionals to determine the best course of action. Rehabilitation and recovery after a stroke. Recovering from a stroke can be a challenging and lengthy process. The extent of recovery will vary from person to person, depending on the severity of the stroke and the areas of the brain affected. Rehabilitation plays a crucial role in the recovery process and may include physical therapy. Physical therapy aims to improve strength, flexibility, and mobility. Occupational therapy. Occupational therapy focuses on regaining the skills necessary for daily activity and work. Speech therapy. Speech therapy helps individuals regain their ability to speak, understand, and swallow. Psychological support. Emotional support and counseling can help individuals cope with stroke recovery's physical and emotional challenges. It's important to remember that stroke recovery is gradual and patience is key. Individuals can make significant progress in their recovery with the right support and rehabilitation. Conclusion: taking action and spreading awareness about stroke symptoms. Strokes are a serious medical emergency that can have devastating consequences. Life can be saved by recognizing the warning signs and taking immediate action. These warning signs should not be ignored, whether it's sudden and severe headaches, weakness on one side of the body, or changes in behavior or mood. Spreading awareness about stroke symptoms and prevention is crucial in equipping individuals with the knowledge they need to protect themselves and their loved ones. Remember, time is critical when it comes to strokes, so act fast and seek medical attention if you suspect a stroke. Together, we can make a difference in stroke prevention and early intervention.